Hello friends, welcome to my channel Pharmacy with Hemant. Let's talk about antacid in today's video. I will explain about definition of antacid, types of antacid, mechanism of action, combination used, indication, contraindication, dose, ADR, drug interaction and precautions using antacid. Let's start today's video from the definition of antacid. Antacids are weak bases that react with gastric HCl and convert it in salt and water, resulting in increased gastric pH. In layman term, antacid is made up of two words, that is antacid. The chemical which shows the effect against the acid is known as antacid, or it is used for the neutralization or increasing the gastric pH. And another important thing about antacid is it only neutralizes the secreted acid in gut by neutralization reaction and does not inhibit the acid secretion. So it is given during hyperchlorhydria, that is hyperacidity. Hyperacidity or hyperchlorhydria means increased secretion of hydrochloric acid in stomach compared to normal condition. And factor causing hyperacidity are excess alcohol and smoking. As we know that consuming alcohol is injurious to our health, so one of the problem caused due to alcohol consumption is hyperacidity. Next is stress, and eating certain foods like spicy foods and more non-veg items. Some drugs like aspirin, paracetamol, ibuprofen, dexamethasone, prednisolone also causes hyperacidity. Mainly there are two types of antacid, that is systemic antacid and non-systemic antacid. Systemic antacid means which get absorbed and reach systemic circulation, where they are water soluble and potent neutralizer. There is high risk of ulcer perforation due to carbon dioxide production in stomach, so it is not preferred in treatment of gastric ulcer. Another major disadvantage is may lead to systemic alkalosis, which may harm body cells. But this systemic alkalosis can be used during poisoning of acidic drug to excrete the acidic drug metabolite from body through urine. Some example of systemic antacid are sodium bicarbonate and sodium citrate. Non-systemic antacids are insoluble in water, so they poorly get absorbed in blood. That's why it does not show any systemic side effects. Some example of non-systemic antacids are magnesium hydroxide, magnesium carbonate, magnesium trisilicate, aluminum hydroxide, calcium carbonate, etc. Antacid is available in several dosage forms such as capsules, tablet, powder, chewable tablets and suspension. Some brands of antacid available in Indian market are Diazine, available in tablet as well as gel form, Diavol in tablet form, Diavol Fort in suspension, Peptica in tablet as well as in gel form, Acifix in tablet and syrup form. Mechanism of action of antacid. Mainly antacids are intended for the neutralization of acid present in gastrointestinal tract, so its efficacy depends on the capacity to neutralize the secreted gastric acid. As I told you, antacid shows its effect by reacting with gastric acid and converting to salt and water. For example, calcium carbonate react with hydrochloric acid to form calcium chloride in the salt form, water and carbon dioxide in gas form. Another example is sodium bicarbonate react with hydrochloric acid to form sodium chloride, water and carbon dioxide. Aluminum hydroxide react with hydrochloric acid to form aluminum chloride and water. Magnesium hydroxide react with hydrochloric acid to form magnesium chloride and water. Magnesium oxide react with hydrochloric acid to form magnesium chloride. As you can see that systemic antacid produce carbon dioxide, whereas non-systemic antacid does not produce any carbon dioxide. So non-systemic antacids are more preferred for treatment of hyperacidity or gastritis. Antacid is mainly intended for fast relief from gastric pain, so used in the condition like gastric ulcer, GERD, that is gastroesophageal reflux disease, and hyperacidity. Some contraindication of antacids are pregnant women and patients of kidney failure, hypertensive and congestive heart failure are contraindicated for sodium bicarbonate because the sodium present in antacid get absorbed in systemic circulation and create problem. Whereas patient with liver and kidney failure should not take calcium carbonate antacid. Calcium get absorbed and may cause calcification and several other problems. Some adverse effect of antacid depends on type of antacid, such as magnesium compounds causes diarrhea and aluminum compounds shows side effects like constipation and interfere with absorption of phosphate. Carbonate antacid leads to generation of carbon dioxide resulting bloating and flatulence. As I told you, calcium antacid may result in formation of kidney stone. When using antacid containing sodium, it leads to arterial hypertension, heart disease and renal disease because sodium can get absorbed in our body easily. Due to side effects, after using single antacid, they are given in combination to counteract the side effect of individual antacids. Commonly used antacids are in combination of aluminum hydroxide and magnesium hydroxide. As I explained that magnesium hydroxide causes constipation by relaxing GI smooth muscle, whereas magnesium hydroxide tends to produce diarrhea. So combination aids in normalizing bowel function. Dose of antacid. After meal, there is rise in gastric hydrochloric acid secretion in normal about 120 milliequivalent used for digestion of food in stomach, whereas there will be higher acid secretion in diseased condition in 3 hours. So the quantity of antacid should be taken enough to neutralize the secreted hydrochloric acid. That is, maximum dose of antacid tablet is 7500 mg per day, where 500, 1000 and 1500 chewable tablets are available. If it is in suspension form, it should be taken 15 ml 4 to 5 times a day after food. Mainly, antacid interact with absorption of drug by increasing the pH of gastric acid. If the drug is weak acid such as tetracycline, iron salt, fluoroquinolones, proton pump inhibitors, H2 blockers, ketoconazole, then antacid will interfere by increasing the gastric pH. Antacid increases the excretion from urine by alkalization of urine such as nitrofurantoin. You can see the example in this. It is shown that plasma concentration of tetracycline over the hours after administration of a tetracycline. On empty stomach, the absorption is best, whereas if it is taken with milk, it is reduced, and when it is taken with aluminum hydroxide, forms the chelation with tetracycline and does not get absorbed through our gastrointestinal tract. Some precautions should be taken while using antacid, that is, antacid should not be given within 2 hours of dose of tetracycline, fluoroquinolones, proton pump inhibitors, itraconazole and iron, because antacid will interfere in the absorption of these drugs. This is all for today, friends. If you think this video was useful for you, don't forget to share and like this video. If you are new to my YouTube channel, please don't forget to subscribe my channel. Stay safe, stay healthy, keep watching, be updated. Thank you.